Are there any specific tests involved that tell you for sure that, this is what you have?
Yes. So the clinical signs and symptoms are the most common, and when the patient complains that she is having so and so problems, depending on the large fiber or the small fiber, we would just examine them in the OPD. During the clinical examination, there are various jerks and all what we have to see, and we also test for the sensations, whether the patient is having a loss of sensation, pinprick, cotton touch, and then the vibration, joint position. There are the various sensations. We have to examine them. After that, there is something called as the nerve conduction test. Now, nerve conduction test, it is a test which is done in a particular room at a particular temperature, where the milliamperes of the current is given to particular nerves in our body. Say in my right hand, left hand, I will assess the two nerves, the important nerves, or else in the leg also I will assess the important nerves. Milliamperes of current will be given, and then we'll assess the potentials what can be generated. We see something on the screen like what kind of a velocity they are having, how much is the amplitude, what is the duration. So based on these things, we'll come to know like what kind of a neuropathy are they suffering with, like whether it is the coat or else the axon. Okay. And sometimes if the coat is affected, yes, that condition is quite more treatable. Like we can use the medication to treat that condition. In case of a stem is getting affected, we have to manage the underlying condition and we have to treat it supportively.